Hi there, guys. Welcome to another episode of the Skits and Giggles podcast. My name is Cody. I live with schizophrenia.
My name's Kit Wallace, and I live with schizoaffective disorder.
And today we're going to be talking about something a little more difficult, something that, we've both struggled with in different ways. We're going to be talking about addiction. We're going to be talking about uh, recovery. And I'm going to have Kit do a trigger warning before we get started because this is going to be an episode that not everyone might want to listen to. So, Kit.
So it's a little bit of a heavier episode, so it does come with a bit of a warning. So we will be discussing addiction, we'll be discussing alcoholism, and we'll be discussing self-harm with maybe a mention of suicide. So if those topics are in any way triggering to you, you don't have to listen to this episode. We have other episodes you can listen to. So sit this one out if you need to, and we'll be here when you come back.
And I think that this is really important too because we're all at different parts in our journeys, whether that's our mental health journey or mental illness journey or recovery. So I talk a lot now about recovery. For anyone who doesn't know, I am a recovering addict. I struggled in the past with both addictions to stimulant drugs and opioids. So, this is something that in the last few years I've gotten a lot more comfortable talking about. I've been a lot more of an addiction recovery advocate as well as a mental health advocate. So, this conversation is really important to me. Kit, I want you to kind of tell everyone your background with this and where you're coming from with this conversation before we get into more of the broad topics.
So, I have experience with addiction in two spheres. The first one is that I am a recovering alcoholic. I am 3 years sober now, almost 3.5 years sober, which is awesome. But I also struggle heavily with self harm. And I have struggled with self harm since I was 14 years old. And I am 29 right now. So, it's been quite some time. And that's a little bit more complicated. But those are my two big things that I deal with.
And I didn't mention it before because you also mentioned you said 3.5 years sober from
Almost
alcohol.
almost 3.5. Maybe next month it'll be 3.5, but I'm close to 3 and a
Awesome.
half. Yeah.
Well, congratulations.
Thank
That's
you.
amazing. I also forgot to mention I am this year will be 10 years sober from.
Woo!
Thank you.
Congratulations, Cody.
Thank you so much. And so this, as you guys can tell, is going to be a little more of a intense topic. It's something that has touched us both personally and has affected our lives in very real ways. And I wish we could say that we were the only people living on the schizophrenia spectrum who struggle with addiction, but unfortunately, people living with schizophrenia or schizoaffective disorder or bipolar disorder have some of the highest rates of addiction, and that is something I hear a lot when I talk to other advocates. When I started peer support, mental health peer support, I was shocked at how many people use drugs or alcohol or self harm as a way to cope with what they were going through. So I want to have this conversation, but please keep in mind if at any point you feel like you need to leave this conversation, like Kit said, we have other episodes, we have other content, and it's okay to accept that this might not be the episode for you. So, Kit, I want to start by asking you really about your recovery journey. We'll start there because I think that's the important part. That's the part that I want people to hear first is, we are both in recovery, and recovery is an ongoing process. It's not something with a finish line. And it's something that gives other people hope for if they're still struggling themselves. So let's start there with recovery. And you can talk about it for either of the addictions you dealt with or both, whatever you feel comfortable with.
So I guess I could start with the one that is going the best. I'll start with the one that's going the best first. So I started drinking when I was 19 years old because it helped me cope with the psychosis that I didn't know was psychosis. Like it made the screaming in my head stop. And I found that very powerful. And then as time wore on, I was using it more and more, whether it was to cope with simple stuff or the heavier stuff. And then when I had my psychotic break, it went off the rails. And then when I started having increased symptoms of obsessive compulsive disorder, it made those go away when I drank. So I was drinking all the time. Like I was carrying a flask in my purse. I was just constantly drinking. And if I wasn't drinking, I was dealing with symptoms and it was just not good. And so I ended up going on medication to treat the OCD. So that was minimized. And then I realized that I might have a problem. I was starting to have pain in my liver area. And so I went to my doctor and I was really scared because I was like, oh God, what's going on here? And so I told her what was happening and she ordered some liver tests and she got the liver tests. They came back clear and I realized I dodged a bullet and I didn't know what was causing all that stuff. And I'm like, I need to quit this. I need to quit this because I can't cut back. I can't cut back. I need to quit. So I did what a lot of people do. And I went to an Alcoholics Anonymous meeting and I got a sponsor there night one. And over the next year, I was able to successfully quit drinking with the help of the program. But the problem with it was that it eventually got where the program became a little bit too religious for me, and I struggle with religious delusions, and so they push religion a lot. I know they say that they're not a religious-based program, but a lot of the programs, at least where I'm in the Bible Belt in North Carolina, and a lot of the programs here are religious. And then my sponsor ended up having a massive falling out with me for some reason. She just started yelling at me for seemingly no reason one day, and I decided I didn't want to deal with that anymore. So I actually ended up leaving the program, and I left the program over a year ago. And I don't have any plans of going back, but it did help me get sober, and I managed to stay sober since. And there is studies out there that show that cutting back on alcohol is also a successful way to deal with addiction and the harmful effects of alcohol addiction. But for me, sobriety was the best choice, and I managed to stay sober as long as I have, thanks to the kickstart that the program gave me, and then just me realizing that my life is better without drinking. And so that's the best I've got when it comes to recovery. I'm like, yes, this is where I'm doing the best. But the other bits, the self-harm side is actually the one I really struggle the most with because I started cutting in the 8th grade over just whatever was going on. I was dealing with stress at home and things were really rough for me. And so I don't even know where I got the idea. It wasn't like I saw someone do it. I just started doing it. And my doctor was fascinated that he's like, you didn't see anybody do it, you didn't learn about it. I'm like, no, I just wanted to do it. And so I continued to do that. I continued to escalate. And it got to the point where it was too deep, too bad. I was needing stitches like multiple times and it was not good. And if you see me on any of my social media accounts, I'm like covered in scars. And it's the results of all of that stuff. And so I had one really bad night right in the middle of COVID. And it had gotten so bad that I was like, I probably need to go to the hospital, but this is the middle of COVID and we can't. And so my dad went to the Walgreens in the middle of the night, got butterfly strips, and we patched me up. And I decided then, I'm like, this is the last time. This is the last time I do this. I can't do this again because it was traumatizing my father. It was traumatizing me. It was traumatizing everyone who knew me in my life because they were all worried about me. And so I realized then that I had to change. And the thing about it is that it was so much of my life. It was how I coped for so long that it's been really hard to let go of. But I am happy to say that it's been 5 years since that night. It's been 5 years since I last cut. It's been 5 years since I've made a really bad scar like that. And since then, I have done other things, but the whole point of doing those other things is to not do the big bad thing, the big bad life threatening thing. And so recovery from that is an ongoing process. I go months in between episodes now of doing it. And that's a really big deal with me because back when I was really doing badly, it was every day, multiple times a day. And it was a constant struggle. And so where I am now is that I do still struggle with it. It's been months, but I still struggle with it. And I think that it's okay to not be totally like um all well, because the reality of the world is that you got to meet people where they're at. And oftentimes where people are at is not like me 3 years sober. That's awesome. Like I would consider myself recovered in some contexts from alcoholism, but I still actively struggle with self-harm, and I think that's going to be a thing for a while, and that's just my reality.
You said so many things I can relate to in my own journey here. So, for anyone who's been following me for a while, you probably know I struggle still to this day with different cravings from my stimulant addiction. So even though I am approaching 10 years sober here, I never say that I'm a recovered addict because this is something I think about and deal with every single day. And so my journey with recovery started actually just like Kit's, but I was in jail and I went to a Narcotics Anonymous and an Alcoholics Anonymous group. I had some of the same experiences. The problem also with me in early recovery was I started using as a way to cope with what I was going through. So when I first went to a recovery group, I didn't think that I was an addict. I didn't think that there was anything wrong with me. I wasn't even aware that I had schizophrenia yet. So early on, my recovery was kind of different because I didn't recognize what was going on. I couldn't understand why I was using until years later. So looking back, I started using shortly after my auditory and visual hallucinations started, and there was several reasons that I used. I used opioid drugs because they would quiet the voices. They would stop the visual hallucinations, even if it was for minutes, hours, it was like enough relief from those symptoms that I just kept doing it. And I did this instead of reaching out for help because I didn't think there was anything wrong with me. I was in a delusional state. We talked about in, I think, the third episode, lack of insight. I didn't have insight that I was struggling with schizophrenia. So even though I was having these symptoms, the only way I could figure out to get them to stop was through using drugs. So I started using opioids as a way to uh, kind of silence some of these symptoms. The real problem for me began with stimulant drugs because I became very, very addicted to how stimulant drugs made me feel. They're the reason that I was able to seem fairly normal to a lot of people because they gave me a lot of energy to still do some of the things in my life I needed to do. So when I first started having symptoms, they kind of helped me appear as if I was still energetic and I was still active, but I was delusional. I was still flunking out of college. I ended up losing my job. So, although I thought the stimulant drugs were helping me, they were actually doing the opposite. Same with all of my other addictions. The other reason I used stimulant drugs was because I was struggling with paranoia at the time. And some of the delusions and paranoid thoughts I would have was that I was being followed, or that the FBI was trying to arrest me, or that people in my life were trying to sedate me so that they could put me in a psychiatric facility or put me in jail. And because of that, I started really using stimulants to stay awake for days at a time. Now, anyone who knows anything about the human brain will know that no one should be awake for days at a time. It doesn't matter if you are neurotypical, have no mental illness, anyone can start to experience hallucinations or delusions after being awake long enough. I was awake days at a time, struggling with addiction, in active psychosis, actively hallucinating, and things got very dark very quickly. This is where I spiraled into full addiction. This is where I ended up getting my charges that eventually led to me being incarcerated. And this is not an uncommon story. A lot of people with schizophrenia use drugs as a way to cope. Uh, a lot of people assume when I talk about my passive addiction, they assume that I started using drugs and that's what led to my schizophrenia diagnosis. And so I always have to explain to people I did not use drugs until after I experienced symptoms of schizophrenia. And it was the only way I thought that I could cope with what I was going through. So when I finally got arrested the last time, and I had quite a long, time where I was incarcerated, I found NA and AA. So part of the problem with being incarcerated was it was harder for me to get access to drugs because I was not in a good place mentally. It's not that drugs aren't in jail and prison facilities. It's that I was so unwell that I was not able to get access to any sort of drugs. And that's where I started to realize something might be wrong with me because I wasn't able to use drugs as a crutch anymore. I wasn't able to use drugs as a way of basically ignoring my symptoms. And so, through the several years that I struggled with addiction, once I ended up in jail, I started going to Narcotics Anonymous and Alcoholics Anonymous. But I was going there just to get out of my jail cell. I didn't actually think anything was wrong with me. I didn't think that I was an addict. I didn't think that I was an alcoholic. So I, you know, really got through my time in jail, my time in, AA and NA. And it wasn't until I got released from jail that you guys might remember is when I got access to medication and treatment and I got sober and all of those things. Once I got access to medication, I started to have some clarity. And with recognizing that I was struggling with schizophrenia, I also had enough clarity to recognize that I was an addict. And even though I wasn't having as much symptoms anymore, I was still craving stimulant drugs and other drugs. So it did for me. My the height of my addiction, I was really struggling with prescription medication. I was struggling with cocaine, and there was a brief period where I even experimented with meth. And so things got very serious very quickly. And those are addictions that, if you're a person who already has an addictive personality, they can become very, very hard to quit. And I've seen that a lot in the addiction community now that I'm more a part of it. And so I still think about these addictions every day. It's something that I struggle with a lot. I will say, because Kit was talking about alcohol, when I talk about being sober, some people don't like the fact that I do still drink occasionally. And I don't do it too much because I am on antipsychotics, and you're not supposed to drink heavily on antipsychotics. But
Oh
I
yeah,
do
I
want,
know, I know.
yeah. and so, and so I do want people to know that, because I want to be transparent. Like I am in recovery for uh, my addiction, which was drugs. And I never really struggled that much with alcohol. There was many years where I was abstinence from alcohol just because I was really an abstinence person early on, and I didn't want it to become my new crutch. But now that I'm more stable, I do occasionally drink, and it's one of those things that I want people to be aware of, because one of the things we're about to talk about is harm reduction, and this is really important. Kit's going to talk about it in her own experience. And for me, harm reduction is something that I consider myself still a part of. So, one of the issues I had with AA and NA is they're abstinence only. I struggled a lot with abstinence. What I found worked for me was reducing the harm of what I was consuming. So I went from drug use to finding other things that were not great for me. It led to me being addicted to various other things like binge eating and caffeine, and things that seem like fairly not harmful unless you use them in excess, which I was. The important thing for me is I recognize that I am not just addicted to drugs, I am an addict. I have an addictive personality, and I struggled with gambling addiction. I struggled with all sorts of things. So for me, harm reduction has been finding the thing that I can be addicted to that causes me the least amount of harm. Recently, I still struggle with caffeine. I definitely overuse the amount of caffeine that I need. I like to joke that one of my new addictions is tattoos or social media, but I do think that I find those to be a way for me to distract myself from the addictions that caused me the most harm. So I do want Kit to talk about this as well. And I know you actually have some science prepared about harm reduction. So I'm super pumped to hear some of that. But I'd love to hear your experience also with harm reduction.
So, my personal experience with harm reduction is something that it was like I was faced with the whole abstinence thing. Like, I was told by the people in my life that I needed to stop self harm entirely, stop drinking entirely. And while, yes, abstinence from drinking was the best choice for me, that's the idea, is that it was the best choice for me. There
Yeah.
are people that I know in my life that struggle with alcoholism and they've been able to successfully cut back. And I think that's a really important thing to say, that it's possible. But for me, when it comes to my self harm struggles, is that I alternate between, like, it's hard to explain. So I do things that are not cutting. So I do less intense forms of self harm, because for me the number one goal is to not cut. Because if I cut, I might pass away. Like, I could, because I was at that level where it was like it was really dangerous every time I did it. And so everyone in my life is like, we don't want you to do it at all, but if you have to do it in this, like, less intense ways and stuff. And they're not happy when that happens, but to me I consider it success because I didn't cut. And
Mhm.
so that's the most, and I think you mentioned, you said it really well when you said how harm reduction is doing what's least harmful for you in that moment. That kind of, that thing that is not the really big bad scary thing. It's something that's less intense. And so for me personally, I, while I do still struggle with doing it at all, if I'm not cutting, I consider that success. And so there is another level of quote unquote self-harm that I do, which is less intense even than the other form I was talking about. And it's that I use icy hot. So, icy hot is something we've all heard about, but I don't think a lot of us actually have tried it, so to speak. And so, it kind of has this cool burn effect that can be really intense. And there was a while back where I was struggling with the less intense forms of self harm. And I'm like, I got to try something to try to quit this too. I want to reduce this. And I found this girl on Instagram who sold self-harm recovery pens, and they were basically brush markers that had dark ink in them in different colors if you wanted different colors, but you could also get it in blood red. And in that ink, it had a cool burn effect to it. And so I bought one of these pens and I tried it, and it worked really well to give me the same effects of like seeing the liquid really helped with the sight aspect of like self-harm and whatnot, because a lot of people with self-harm, the seeing blood is a really common thing that they want to happen during a session, episode, whatever you want to call it. And so I tried this pen, and the pen really worked for me, and what really worked in it was the cool burn effect. And unfortunately she doesn't sell the pens anymore because she's having manufacturing issues. And so I said, what if I just try icy hot? So I went to Walmart and I got like the off-brand icy hot, and I put it on the places where I normally would have harmed. And for some reason, that worked. And it's still me doing something, which is why it's still harm reduction. But I
Mhm.
carry icy hot like in my purse, because if I get those urges, if I get the feeling of just wanting to do something, wanting to feel pain, because I just, whenever I get stressed in my life, my brain goes, "Ooh, you should hurt yourself. You should feel pain to deal with this because that's what you deserve. That's what you should feel." And so I'll use the icy hot, and that will actually help with a lot of it. And I don't overuse it. I only use it when I really have to, because I don't want to use it all the time, because it's really powerful when I do use it, because it keeps me from doing the other stuff. But it has been like the missing piece in my whole self-harm recovery journey. And I think over time it could be possible that I'm just using icy hot in between the other episodes, and I might go like even years in between doing the other stuff with the help of icy hot.
I think this is so important to discuss like harm reduction and how it can be beneficial because I also know harm reduction has become a very political term. Like people who don't understand it make it seem like we're enabling people for trying to find ways to lessen or get rid of their primary addiction. So like we hear this a lot now from people who use drugs that require needles. There's a lot of forms of harm reduction out there that people think by doing those we're some way enabling individuals who are trying to consume less or trying to get sober or trying to find their own way through sobriety. I also want to reiterate something that Kit said. Although AA and NA might not have been for us, I do know a lot of people who find success with those types of programs, but we need to remember that recovery is not one size fits all. The same with medication, the same with mental health treatment. A lot of people find different ways through their own journey with sobriety and through recovery. So that's why I really feel like the importance of the conversation around harm reduction needs to be talked about more because a lot of people need that first step. They need something they can do differently, or even if it's reducing intake, whatever it is, uh, we need to make sure that people have the opportunity to get sober. And the best way to do that is to keep people alive. Because if someone passes away from their addiction, we're not going to be able to get them the help they need. So sometimes harm reduction can be just to keep people alive long enough to get them the help they need. And I think people don't look at it like that, but that's how I've always viewed it. And so I know that Kit has actually looked up some studies and stuff about harm reduction. So I'd love to hear about some of those because I do think it's an important conversation to have, especially because I can't do the scientific research that you can do, but I do know just from lived experience and talking to a lot of people in recovery, that there are benefits to harm reduction.
Well, I kind of want to talk about a specific part of harm reduction. There have been a lot of studies that surround harm reduction in terms of people who inject drugs.
Yeah.
And so there are tons of studies talking about that kind of thing. There's less about alcoholism, there's less about self-harm. There's not hardly anything about self-harm. But there's tons about people who inject drugs. And
Mhm.
so the goal of harm reduction in those populations is to reduce mortality, to reduce overdose. And so a lot of harm reduction techniques are basically to provide people with like fentanyl test strips to give them Narcan, that kind of thing. There's a lot of needle exchange programs to have them, if they're going to do it, they do it with fresh needles. They do new needles so that they don't get hepatitis and HIV and other bloodborne illnesses. And so I want to highlight a specific thing is that there are places that are supervised consumption sites. And they're also known as supervised injection facilities or overdose prevention sites. And those, once again, the goal is to reduce mortality, but it helps with disease prevention because everything in those places is clean. So it's a safe place for people to inject drugs with safe equipment and whatnot, and it gives them a place to do that. And you'd think, why would you want to do that? You're just encouraging people to do drugs, to inject those drugs, to use those substances. But what's really interesting is that the results of these sites from data around the world is that even if they don't do the injections there, they're safer outside, meaning 75% are safer when done outside the sites. And then 80% of them, in this one study I read, they're doing less rushed injections, which can cause unsafe practices. And so I thought that was a really interesting thing because when talking about harm reduction, I think going to the extreme where we talk about people who deal with injectable medications, and a lot of it also, I do want to point out, a lot of it is also getting people to maybe not inject, maybe to use a different form of consumption, whether it's nasal, etc., that kind of thing. And so a lot of it is just getting people to do it safer. And those people who do it safer, some of them who go to those sites end up going on to be in programs to cut back and even get sober. And so the result of this stuff is that harm reduction saves lives, it helps people, and it actually is a valuable tool to keep people safe and then help them eventually, hopefully, get sober.
One of the most frustrating things I think right now about being an addiction recovery advocate is, addiction recovery has been very politicized by both sides. Both sides try to use addiction as a scapegoat for a lot of issues out there, and we need to remember that people struggling with addiction make up some of the highest rates of incarceration and homelessness. Right there is another reason why harm reduction can be really beneficial is when people look at addicts, I think they forget like they're people and they're people who eventually could get sober and could have a really amazing life, but they're not going to be able to do that if they die of an overdose or if they succumb to their addiction, whatever it may be. So harm reduction, in my opinion, as someone who has used harm reduction as a way to stay alive, allows people a second chance. And I can't see how giving people a second chance is negative for anyone because right now there are people struggling and the only way they know how to deal with it is through addiction, whether they're struggling with undiagnosed mental illness, which I know a lot of addicts and very few of them don't have some sort of underlying mental illness or serious mental health concern. So a lot of people who are struggling need other resources and they're not going to be able to get those things if they can't find a form of either sobriety or harm reduction. So, thank you so much for doing some of that research and looking that up because it is such an important conversation. And at the end of the day, like this is a hard thing to talk about for both of us. You know, we both have our individual journeys with it. Really struggle talking about being an addict because I feel guilty almost. Like it's really strange for me because I understand that I have no control over schizophrenia and mental illness. And the same could be said for my addiction, but I never looked at it that way. I always looked at it like it was a fault of my own. Even though substance abuse disorder is a diagnosable mental illness and it is something that a lot of people struggle with and I always get embarrassed talking about it. So this is a really not only deep conversation. This is hard, I think, for both of us. I
Yeah,
know
yeah.
that we talked about this going in, that we wanted to make you feel comfortable doing this because it's not something you've talked about a lot as well.
Yeah, I actually also struggle with thinking it is my fault, entirely my fault, because it was my choice to hurt myself, right? Or it was my choice to take that drink, right? And so struggling with that and letting myself just accept that it is a mental illness. The things I do are because of a mental illness. It is not my fault that I'm dealing with these things. And while I do take responsibility for all the actions I took in my addiction, whether it's past, present, future, etc., I will always take responsibility for what I do. It's still not my fault that I do those things because it's part of a mental illness. And so giving myself grace, giving myself a little bit of slack when it comes to this stuff, like when I have little relapses, little lapses. I hesitate to call them relapses, but lapses. I just need to be kinder to myself. And I think if anyone out there is struggling with it and you too have issues, like give yourself grace. You're doing your best. Like all of us are doing our best in this world and things are hard sometimes.
And please remember, there are a lot of resources now for people struggling with addiction. There are a lot of different organizations, and you might benefit from AA or NA.
Mhm.
Although it didn't work for Kit or I necessarily, I know a lot of people who have found recovery through these programs and through abstinence. But I just want people to know there are other options out there and that there is help out there. I think anyone struggling with addiction tries to isolate themselves, tries to not feel like they're a burden on the people in their lives. And that was the case for me. And so please know that you guys are not alone if you're listening to this and you're currently struggling, or even if you're a caregiver for someone who is struggling, there are other options that you can look into, ways that people in your life can get help or that you can get help. So I just want people to remember, same when I talk about mental health or mental illness, you are not alone. And finding peers can be really helpful. And finding people who have been through addiction can be a great way to, jumpstart your sobriety or jumpstart your harm reduction process. So, also want to give Kit a second for any final thoughts that you might have for anyone who's listening who might be struggling.
Yes, just know that there is no good or bad when it comes to addiction. This is the real world and it needs to be treated as such.
Thank you guys so much for listening. We really appreciate all of the support on the podcast. You guys have been really showing us love on social media. And please continue to reach out to us. We're taking in all of the ideas, all of the guest suggestions you guys are sending us. And it's really helpful for us to know what the audience wants to hear. So be sure to follow us on Instagram, TikTok, and YouTube. You can shoot us an email at skitsandgiggles@gmail.com. And you can listen on Spotify or Apple Podcasts, anywhere you listen to podcasts. Please be sure to leave us a rating. We really appreciate it. Kit, do you have any final thoughts for the people today?
Yes, of course I do, Cody. Guys, just remember the brain is a minefield and we brought flip flops.
Thank you guys so much.